Welcome back to News First. At a public hearing for Speaker BJ Cruz's Bill 3, GRMC came to the table and testified and cautioned Speaker Cruz that if he didn't include language in the bill requiring all insurance providers to include GRMC as an in-network provider, a large portion of GovGuam employees, specifically those with Take Care insurance, will surely suffer the consequences. Here's more. Eric Plinsky, the Director of Corporate Affairs for the Guam Regional Medical City, testified today at a public hearing for Speaker BJ Cruz's Bill 3, a bill that would ensure that only the most economical and affordable health care insurance proposal plans are forwarded to the governor for approval, and that the legislature hold final approval over the signing of any such contract. Plinsky today, though, lobbied Speaker Cruz to include language in the bill that requires any bidding proposals in the future to include GRMC as an in-network provider. Plinsky says this is critical because the effects, both current and future, of cost incurred by patients who go to non-participating providers can be seen in an ongoing situation with Take Care Insurance and the Guam Regional Medical City.
The biggest thing that people don't understand, and I would assume you may have a difficult time understanding what non-participating provider means and the famous quote, eligible charges. What that means, and I can explain in detail right now, for instance, the one plan who has not put us in network, it doesn't mean that there's necessarily savings anywhere. It just means those costs are going to have to go to someone else. We're holding over $5 million of claims for that provider. We have not sent those to the customers, your GovGuam employees, retirees, federal workers, because we're in negotiations to try and work out an agreement. If we were to release those bills to those patients, we're going to have to eventually, if those good faith efforts don't work, imagine the bankruptcies that people will face if they have to pay these full bills.
GRMC is currently negotiating with Take Care to work out an agreement to prevent the full payment of those $5 million in claims, but he cautioned against the non-participating provider clause in general, which he says all health insurance plans have. Plinsky says if a patient is brought to GRMC, for example, and the hospital is not an in-network provider, which GRMC is not with Take Care, they would likely have to pay the full bill up front before being reimbursed, not even at 100% of the cost that they incurred. Currently, the going rate for a private room at GRMC is $2,400 compared to $600 for a semi-private room at the Guam Memorial Hospital.
To us, it's critical. We built the hospital. We invested hundreds of millions of dollars to offer specialty care that was never available here before.
In his testimony, Plinsky says that if Bill 3 passes without the requested changes, insurance companies will essentially be able to cut GRMC out of their networks just to compete strictly on price. Speaking on behalf of GRMC, Francis Santos, current Consolidated Commission on Utilities member, asked Speaker Cruz why Guam would offer QCs or tax breaks to GRMC to invest on island, but not allow residents with certain insurance plans to choose GRMC as an in-network provider.
If you're going to allow this system to, not choose this hospital versus this hospital, then we should really look at why we're giving QCs. Because the promise was, no, I'm going to allow this hospital to come on our island, offer this benefit, and offer, more importantly, to the residents that cannot afford to come to the hospital. So again, I caution you to examine that closely and say, okay, the balance you gave us, I'll speak on behalf of GRMC, was that you want us to be on this island and provide this service. So we're here today. So all we're asking is that give the residents of Guam the chance to choose the hospital, and just put us in the network is all we're saying. We'll negotiate. And that's our challenge, to negotiate with the carriers.
Department of Administration Director Christine Boleto and Calvo's Select Care Plan Administrator Frank Campillo also testified at the public hearing. You can see more online at pacificnewscenter.com.
Well, after a month at sea, sailors